for coming. How you doing?
Good. How are you doing?
I'm doing very well. Very looking forward for this interview. So, how it normally works, Jeffrey, is that I ask you a couple of personal questions so people and the audience know you a bit better, and then later we can go to the more business-related life experience, business things. Is that okay?
Absolutely.
Cool. So, one question I love to ask is if you could wake up anywhere in the world tomorrow, what it would be and why?
Hmm. I would say, definitely if I think about it
Uh-huh.
from a tangible perspective, somewhere on an island or, on a cruise ship. I love cruising and,
Okay.
definitely somewhere very warm, tropical, somewhere where I can enjoy a nice drink and nice scenery.
Okay. And what is the first top place that comes to you?
I mean, I've been to many different places. I would say if there was a place that I haven't been to, I mean, I haven't been to Hawaii. So, that may
Okay.
be a neat
Hawaii.
place to explore.
And this is the favorite Japanese island for Japanese people.
Exactly.
Yeah. All right. Very good. So, okay. Second question. If I ask you, well, because you are a father, if I ask you what was the second happiest moment in your life, not the first, okay, what would you say it will be?
So you're saying my second, because I can't say being a father, or
Yeah. Yeah. You cannot say being a father.
yeah. The second happiest moment. That's a really interesting question. I
Mhm.
would say there's many that come to mind, but I'll say that probably one of them
Mm-hmm.
was this past summer. I had the privilege of taking my entire family to Germany with my mother. My mother was born in Germany, and obviously, the opportunity for her to share that experience with me and my sons, as well as my wife, was a really special and meaningful experience. And we even got to take our boys to see the home my mother was born in.
Wow.
And so that was a really, really an experience of great meaning and purpose.
All right, very cool. That's nice. That sounds very beautiful, Jeffrey. Thank you. Thank you for sharing. All right, very good. So I wanted to know, a bit more. So if you could give us a brief summary of what have you done and what do you do now, Jeffrey? So what would be?
Yeah. So obviously, I'm the son of a nurse, and my mother had a huge impact and influence on not just my career pursuits, but certainly in raising me. And entered my first job as a hospital administrator. Served for just under 10 years in the same health system, and wonderful experience. I tell people all the time it was the best job that I ever had. In so many
Okay.
ways, from a culture standpoint, from a leadership standpoint, and was fortunate to work for leaders who just truly poured out their soul to help me be successful and help
Uh-huh.
me grow personally and professionally. After that, actually came into we as a health system went through a merger process, and so my
Mm-hmm.
my role, like many other leadership roles, were impacted as part of that process. I came into academic leadership, serving initially as a vice president at a small liberal arts college, reporting to the president and leading all aspects of strategy and partnership, and did that for a period of time, and then actually was recruited by another president to be a part of his cabinet at a STEM 4-year university, and
Okay.
led all aspects of strategy partnerships there. And then was recruited to an ed tech company, which is actually where I got to meet our mutual colleague and friend Johnny
Okay.
DeGrider, and
Cool.
Johnny was on my team there. That was an ed tech company, global ed tech company, where I had the privilege to work. Actually, did some work even with a Brazilian organization,
All right.
ironically,
Nice.
and
Okay. Cool.
Med Portal is the
Uh,
organization, and did a
uh,
lot of work globally around career mobility, education, and how do we
uh,
lift up things from an equitable standpoint within the education system. And then went into another organization called Core Education, which is an operating partner to higher education institutions to lead their national healthcare practice, and still serve there today. And
Okay.
then was recruited this past May to be the inaugural director at Siemens Healthineers in North America, which is the United States and Canada, to lead workforce development, and develop the next generation healthcare workforce within North America.
Very good. That's very interesting. That's a very long track record, Jeffrey. I
It's
was
all,
wondering.
every day is a new chapter. That's how I look at it.
Yeah, that's good. That's good. Healthcare is something that it really interests me, and I think it's very important. And I was wondering, what are your main lessons learned from this experience? That what are the main issues and main challenges, for instance, Jeffrey?
Yeah. So I mean, obviously healthcare has many challenges, and
Mm,
particularly from a global perspective, we're facing probably one of the most challenging times from a workforce perspective, where we
mm,
don't, we've got issues around retention.
sure.
We have issues around, we don't have enough students coming out of colleges, community colleges today, to support the growing openings from a
Mm,
workforce perspective.
all right.
Have a lot of culture issues. And we can't hide behind that. Healthcare has been an industry that overwhelmingly has not had retention issues for a very long time. And the main
Uh-huh.
reason for that is that healthcare, at least in the United States, was always a place where you could expect very good salary, very, very good benefits, and people wouldn't necessarily leave. If they did, they would just go to another healthcare system.
Mm,
Today, that's not the case. They're now leaving, acute care and going into a different aspect, whether it's a startup, whether it's leaving healthcare altogether. And so we've got a lot of challenges from a workforce perspective. The second thing I
mm,
would highlight is, we, at least in the United States, have talked about for a very long time moving to value based care. We still have not moved to value based care. And a lot of it comes
okay.
down to the fact that healthcare is a risk averse, slow to move industry. And there's challenges with that, though, because we're still in a pay for performance system. And, or
Uh-huh.
excuse me, we're in a pay for volume system. We need to
Mm,
move to a pay for performance system, where hospitals and physicians are reimbursed based on performance, meaning quality, as compared to being reimbursed on volume, meaning cases. And
uh-huh.
so we have that challenge. And then the other one I would just add is, we've got to continue to advance a more equitable healthcare system. Healthcare is not equitable.
Mm,
Doesn't really matter what country you look at, it's not equitable. And so
yeah.
we've got to advance a more equitable healthcare system.
Especially in the USA, I would say, right? Because there is
Absolutely.
here it's hugely expensive, I hear. Okay, I see. I was, interested in this value-based care, right? Because I think that's very important. It's something that also I have become aware of, about this pay for volume instead of pay for performance. So, yeah, how can you, or what are the challenges? How are you addressing those issues, Jeffrey?
Well, I mean, you have so many challenges, at least in the United States healthcare system, because we still have, a system where generally payers and providers are not on the same page. And
Mm-hmm.
that, makes it very complex. And when I'm talking about payers, I'm talking about our insurance companies, managed care companies. There are circumstances where a hospital health system actually owns a payer. And in those situations, it can be a little bit different because they do have the opportunity then to really look longitudinally at the experience of a consumer or patient, but also from a payer end, they're able to see a lot of data. The reality, though, is we've got to continue to advance this. We've got to have a value based care system. It is the right
Mm-hmm.
thing for the patient. It is the right thing also for all of our healthcare professionals. Uh, and so, we've got to advance that. The other piece I would add to this that's an important aspect to this, and there's a larger movement on this now in the United States,
Uh-huh.
is nursing care needs to be reimbursed. Our nurses are the heroes of
Uh-huh.
healthcare. They are by
Sure.
far the individuals that everyone trusts within healthcare, and they are the ones that spend the most time with our patients. And yet they are not reimbursed for the services that they provide within our healthcare system.
What do you
And there's
mean
a
they are not
movement.
reimbursed? Sorry, Jeffrey. What do you mean they are not reimbursed? They are not paid well enough,
Yeah,
or they
so
are not compensated enough?
under the circumstance today, a hospital cannot get reimbursed for nursing care.
Ah,
Even though the nurses, do a lot of the work, they're not getting reimbursed for that. Meaning the hospital
oh,
isn't. Now, we have seen, and why that's important is nurses are viewed in our healthcare system as a big expense to the healthcare system. But when you really break it down, they are the ultimate value in the healthcare system. And we've
uh,
got to update our reimbursement models to reflect that. When you
that's
look at
crazy.
population
Uh-huh.
health, when you look at advancing health equity, when you look at all aspects of quality, nurses are generally the first individuals that help and not just contribute but lead the way.
Mm-hmm. Okay, definitely. No, that's a good point. I didn't know about this, so it's very interesting. Jeffrey, I was wondering, another thing that I've been thinking about the healthcare world, is look, I look it from the side from the coaching and the mental health point of view, right? I think that many times when people look for help or for something to be treated, it's too late. So I think sometimes it could be better to start earlier, right? So to have this kind of maintenance kind of healthcare system. I don't know if this is something that is being addressed or is being implemented, or you need to go to the value first and then to the preventive care system later.
Well, it depends on where you're talking, right? Are you speaking more about what we do for our employees from a mental health standpoint?
I was not talking about mental health. Like mental health, I think that's definitely a thing that it can be done and it should be done. I meant about the general health, like for instance, diabetes,
Mm.
obesity, and all these issues, right? Many people, it's like going to a car shop just when the car breaks down, instead of having a maintenance
Yeah.
every year, every few months. So I saw that there are tests that they can be done in a maintenance basis, just to checkups, general checkups that the health system should cover in order to, encourage people to take care of their health. For instance, here in Brazil, this month of November is the blue month. So it's just to make people aware in this country that men should do some health checks, to make sure that everything is in fine. And
Mm.
last month, which was October, it was the pink month. So that was like the month of awareness for women. And I think it was good, I think it was a good idea to make people aware that, instead of waiting until something hurts in your body or in your system,
Yep.
and yeah. So yeah, I don't know what's your opinion about that.
Yeah, no, I mean, we have similar months obviously in the United States too, and
Uh-huh.
I think overwhelmingly our healthcare systems also do a really good job of promoting public health and promoting screenings, promoting
Uh-huh.
prevention. Obviously the Affordable Care Act, which obviously was signed into law in 2009 by then President Obama, has had a great impact when it comes to preventative health. We have
Uh-huh.
a lot more work to do. We definitely have a
Mm-hmm.
lot more work to create a more equitable system, but without question, the preventative side of healthcare is very critical. And I think as we further move to a value-based care model, we'll continue to see that advance. But I mean, let me just say, for example, we're in November, right? To your point, it's no shave November in the United States, so you would fit
Ah,
right
okay.
in. You don't have to shave in November here, and you raise money for prostate cancer awareness.
Yes.
Movement, it's a big initiative.
Uh,
Obviously, I can't follow it, but the
sure.
reality is it is important, and so
Yes.
there's a lot of initiatives like that.
Okay. Yeah, no, I remember in UK there was the same thing, about not shaving. I remember in Glasgow when I was working there. Okay, very good. Now, in terms of leadership and all these things, different roles that you take and you took, and you had this connecting, right, and hard leadership. So I was wondering, what are the main lessons learned that you have from that standpoint?
Yeah. I think to your earlier point, and we referenced this, right? One of the biggest challenges in the workplace today is culture.
Mm,
And when you look at the statistics, generally the statistics are going to report that somewhere between 70 to 80% of people who are leaving their jobs today are leaving because of their boss.
mm,
And I think um, that's not a shock. People want to be in a work environment that's healthy, and they want to be in
mm,
a work environment where they're respected, appreciated, and valued.
mm-hmm,
And when you have a leader who does not subscribe to that, who does not practice that, it makes it very, very challenging. And so, as I shared in the earlier part, I was blessed to start my career with some of the very best leaders that I've ever worked with and worked for.
mm,
And in those experiences, I was able to learn not just what was right, but to really understand how you practice it. And
mm,
then as I continued to grow and continued to study and then became a leader, of team members myself, what was always most important for me was you've got to connect with the team that you lead. It can't
mm,
be a
sure.
transactional relationship. It can't even be
Mm,
a strategic relationship. It has to
mm,
be a 100% human centered relationship. Now,
mm,
when you say that, there's going to be critics who are going to say, well, he's just a fluffy type of leader. He's just going to be fluffy. It's not about being fluffy. It really is about being somebody who can authentically and intentionally connect with another person to help them be successful. That doesn't mean
uh-huh,
that you do not, yes, every leader has to hold a team member accountable, just like I've got to be held accountable at times. But you can
sure.
hold someone accountable with respect, and you can
Uh-huh,
hold someone accountable with still an appreciation for who they are. And I think too many
mm,
leaders today just fail that test. They're
uh-huh,
not they're not concerned about others. They're just
uh-huh.
concerned about themselves.
Yeah, I was thinking, that in this healthcare environment, because I've been being a project manager in engineering, and with banks, with lenders, with all that, which can be stressful. But for doctors, and this healthcare system, when sometimes I think, and this is my opinion from different places that I've been, where I have met doctors, right? There are a stressful environment, right? People are dying, or there is an accident, and there is a rush. So doctors are sometimes, could be overwhelmed, with the amount of work that they have been requested to do. So yeah, how do you balance that, right? Because sometimes they just need to give straight orders, and that they don't have time to small talk, maybe, or to connect in that sense.
Yeah, I think you balance it with both aspects of mindfulness, and you also balance it with aspects of reflection and
Mm-hmm.
providing systematic approach to to really resilience. Right. So
Mm-hmm.
when you look at healthcare is by far one of the most stressful, one of the environments that literally could go from being a little bit normal to chaotic crisis in a second.
Mm-hmm.
And
Definitely.
as a former, as a previous hospital administrator, I saw this on a daily basis. I could walk into the emergency room and we would have 20 patients and people's needs were being met. And then, you'd hear on the intercom trauma alert. And then all of a sudden, many, many patients were coming in with very, very severe situations. What's interesting about that is that if you study hospitals in crisis, they operate so well. People are working as a team, they're working totally together, and it is really, really impactful.
Mm-hmm.
One of the
Sure.
things that we have to do better in healthcare is we have to give both our physicians as well as all of our clinicians and healthcare professionals the opportunity to debrief. Debriefing is very, very important. And,
Uh-huh.
debriefing is both formal and informal. And to your example of a physician, physicians have a stressful job. Well, so do nurses. And we've got to give them a chance to pause, reflect, talk about it, provide resources to them, not expect them to get right back in the game. You think about it from a military perspective, or you think about it from from an athletic perspective, especially from an
Mm-hmm.
athletic perspective. When someone gets hurt on the football field, we take them out.
Uh-huh.
When someone gets hurt in healthcare, we don't always take them out.
Uh-huh.
They're right back in there. They're working those shifts. And so we've got to give them a chance. We've got to give them a chance to take a break, talk to somebody. And so we've got to just be thoughtful around this, because at the end of the day, mental health is very, very important. And
Uh-huh.
burnout will happen when we don't systematically deal with those situations.
Uh-huh. Definitely, definitely. That's what I was thinking, that sometimes the system is just could be the issue, rather than the physician's capacity to lead. Because in those situations, they are not favorable in that sense, and they are demanded to work long hours. I sometimes didn't understand why they have to work sometimes 24-hour shift and all these things, when this is proven that doesn't, brain, brain and mind's point of view, it just doesn't make any sense. You make the brain exhausted, and it tends to make more errors, and
Yeah.
failings, and bad decisions. All right.
Well, and to your
Yeah.
exact point, if you look at the airline industry has timeouts. Healthcare doesn't have a timeout. To this
Listen.
day, in the United States, there is not a timeout. And
Uh,
so, from a quality perspective, from a risk management perspective, from a taking care of our people perspective, there should absolutely be timeouts. You
Definitely.
can't expect anybody to work a long shift, and be the best that they can be. And we've got to have those types of systems in place.
For me, it just doesn't make any sense, because these are such an important people. And I was wondering, why is that, Jeffrey? Is because of lack of resources, lack of competence, and they have no other choice, or
Yeah, I mean, look, I mean, there's definitely a challenge with resources, right? But at the end of the day, it all comes down to a system that was built really to support our insurance companies to be profitable. I mean, we just have to be honest
uh,
with
all
that.
right. No, it's
And so,
interesting.
it's a system that has systemic reimbursement issues that ultimately have been driven by profits instead of being driven by people. And
Interessante.
you know,
Very interesting.
that's not going
Yeah.
to be a solution. When we're talking about keeping people whole person healthy.
Sure. Yeah. No, definitely. No, that's crazy. It's all about the money at the end. Crazy. Okay. I don't know. We have 7 minutes left. I'm loving the interview so far. I'm learning so much from you, Jeffrey. Thank you so much. I just wondering, is there anything else you would like to share that is important and impactful for you?
Yeah, no, I mean, what I would just say too is, especially when you think about, you know, healthcare, one of the things that's getting a lot more discussion now, which is really encouraging, is, this importance around career and economic mobility. And, I think we've got to be very intentional around supporting our colleagues to grow and giving them access to education, and access to leadership development that will help that happen. And
Okay.
we always have to make sure that diversity, equity, inclusion, and belonging are at the forefront of that. We
Mm,
have
yeah.
a huge need, at least in the United States, to ensure that our healthcare clinicians, doctors, and professionals look like the patients that they serve. Everyone wants to be treated well, but we also want to be treated by people who we can trust, and who can communicate with us to meet our needs wherever those be. And,
Mhm.
we've got to have a workforce that reflects that. And so we have a lot of work to continue to do in that area. As you know, the United States has become more polarized, and diversity, equity, inclusion, and belonging becomes a
Everywhere, I think.
political issue.
Uh-huh.
And as I say to people all the time, uh, we all want a community. We all want to be in a community. We all want to be heard. We want to be respected, valued, and appreciated. And
Uh-huh. It's
when
our
you
need to
really
belong.
Yeah, and you need to
Yeah.
belong. And so when you look at the idea of a community, belonging is the central aspect of that. It's a fabric
Yeah.
of every part of a community.
Yeah.
And so
Connection. Hmm.
um, we as a healthcare community need to not stop those efforts. We need to plow forward and continue to ensure that it's integrated into every fabric of our organization because it will truly make a difference, not just for our people, but also for our patients.
Very good. Very good. And how can you do that, Jeffrey?
Well, I mean, you got to have systematic trainings. Those, and let me say, uh, let me just say, I shouldn't use the word trainings. I really should, say, workshops and different activities where with simulations and crucial conversations. You've got to have education at the forefront. You've got to have policies and procedures that reflect the nature of advancing those aspects. You've got to
Hmm.
certainly educate leaders, but at the same time, you've got to educate, all professionals in that space.
Hmm.
You've got to hold people accountable, meaning you've
Uh-huh.
got to embed that into performance reviews. You've got to embed that into promotions. You've got to embed that into the hiring practices. You've got to embed that into the retention practices. Every fabric has to be touched within that manner. And so it has to be an active, engaged, intentional effort. You can't just say you want to do it. This is not about putting lipstick on a pig. This is about truly making sure there's a comprehensive strategy to make sure that we're advancing it forward.
Very good. Okay. Thank you so much for sharing that, Jeffrey. Interesting. I there is a question I normally ask at the end that I really love. If you could leave a big message, Jeffrey, to the whole world, what message will you leave?
That's a big, big question.
Uh,
I think the message I would leave would be back to something we just talked about before, that
mhm,
when we're at a time where we have a global epidemic of mental health,
mhm,
that is not going to go away overnight, and certainly is not going to go away even over years. It's going to continue to be a significant challenge for a myriad of
uh-huh,
reasons. We have got to really embed a sense of belonging in all the work that we do and in all the organizations we're a part of, and certainly in the teams that we're a part of or teams that we lead. It has to
uh-huh.
be a cornerstone of all aspects of the work that we do. Everyone wants it, everyone seeks it, and
It's interesting. This very interesting. That's why I do what I do. Because I think there is a lack of connection everywhere. And not only in the workplace. I think it's also in normal relationships nowadays. Because of for technology, right? Main reason I think social media, big comparison and all that. So yeah, it's challenging. It's challenging. I think to do that. And I think, as you say, world is becoming more polarized. So interesting. What is your way to make this sense of belonging or connecting with simpler?
well, I mean, I think to your point, right? It is about connection, and certainly the world is different. To your point, technology has an important aspect to that, but we've got 7 different generations in the workplace today,
Mm,
which means from a workplace perspective, you've got to manage to 7 different generations, and you've got to lift up what makes each and every one of those unique. And instead of criticizing or talking about what the negatives may be, if we just channel and think about what positively we can get out of the fact that we've got 7 different generations, that's the beauty of diversity. If we can then make
mm,
an inclusive community out of that, we will see great results. And I
mm,
think, that's that point to your point about connection. We've got to authentically drive connection and understand one another. We don't always have to agree with one another, but we've got to have an understanding and a respect. And I think then through that, we can really advance, not just a sense of belonging, but also a sense of moving forward together.
totally. I completely agree with you, Jeffrey. Thank you so much for this time and for the interview. I don't know if there is any last words that you would like to leave.
No, I was just obviously happy to, happy to connect, happy to engage with anybody. Feel free to reach out on LinkedIn, and obviously, thank you for all the wonderful work you're doing, and I love the fact that you have a focus on a growth mindset. Uh,
Mhm.
you know, uh, it's so important for all of us to be focused on that.
Yeah, yeah, definitely. Thank you so much, Jeffrey, and for your kind words. Talk to you soon then. Thanks a lot.
Thank you.